Mental health care advocates are sounding the alarm about rule changes by the state. Advocates say it would eliminate some 10,000 providers from a mental health care system that's already overburdened. News 8's Barton Dieters is here now to outline the potential impact.
Well, Sue, licensed professional counselors are at the front lines of mental health care, providing basic mental health care for an estimated 150,000 Michigan residents. LPCs say the rule changes by the state would put them out of business.
They are taking away my ability to diagnose, as an LPC's ability to diagnose, and also restrict our work with our clients by taking away our counseling techniques.
LPCs like Kelly Ryan of Granville have approved techniques to help people with personality disorders, stress disorders, anxiety, depression, and destructive behaviors.
I deal a lot with kids who have experienced trauma in their past and working through that whole process and moving on in life.
Ram says the proposed Michigan Department of Licensing and Regulatory Affairs rule changes would restrict their ability to use these techniques and keep them from getting insurance reimbursement.
Taking away our powers in this way would leave us to be life coaches, which is useful, but it's not what will resolve mental health issues.
West Michigan has a well-documented lack of psychiatric services.
Let's take out about, 10,000 of the mental health providers, and you're just going to see those wait lists grow.
She says the impact would be pronounced.
To dump 100,000 more clients on their caseload would be devastating to the community.
Laura released a statement a few minutes ago where they said the current rules are out of date and the changes are needed to protect the public. The statement goes on to say the changes do not define the scope of the LPC's practice.
Back in the 1980s, the late 1980s, the state of Michigan allowed the LPC to come into the state to practice as counselors. And up until that point, it was just the Michigan Psychological Association and social workers, so we kind of encroached on their territory.
Ram says there is room for improvement in her field, and she points to a state bill that would call for more continuing education and define the scope of services provided. She says that bill would nullify the LARA changes.
The rule changes could be in effect as early as November. A public meeting will be held on those proposed rules in October in Lansing. I've heard from several West Michigan LPCs who say they will be there. We have more information at woodtv.com. Back to you.